my name is Corinne and I'm a midwife, lactation consultant and tongue-tie practitioner at Princess Alexandra Hospital. I'm going to talk to you about breastfeeding. Breastfeeding has many health benefits, and just a few that come to mind are babies get less colds, coughs, ear infections, diarrhoea, tummy bugs. If they're breastfed, the more breastfeeding the better. It reduces their blood pressure. It also reduces allergies and obesity and type 1 and type 2 diabetes. If you exclusively breastfeed, it reduces sudden infant death by 36%. The incidence is 1 in 3,710 in this country. It also affects the baby's microbiome, so good bacteria if you breastfeed, and it helps to reduce things you acquire, you don't catch, like diabetes, Crohn's, Parkinson's, cancers. Breast milk kills over 40 types of cancer. It's quite something. In a mum, it reduces pre- and postmenopausal breast cancer, means your bones are stronger, and it also reduces your chance of heart disease. Your breast will produce colostrum at the beginning, which is low volume, high value. Your baby's kidneys are immature at the start, so the baby can only process small amounts of breast milk, which is why nature's given us colostrum. And over the coming days, the baby's kidneys work better, and then you get lots more water in your breast milk around about day 2 or 3 or 4, and that's when the baby takes larger volumes. And colostrum is packed with protective factors, and it's got strong anti-inflammatory factors. It makes the baby's gut grow, and it acts as a natural laxative, which makes the baby poo to clear meconium. So that black poo when the baby comes out is full of something we call bilirubin, and as the baby poos it out, it reduces jaundice. It's a fantastic normal thing. Responsive breastfeeding. So we teach responsive breastfeeding, which is really important, and this is when it helps you to provide closeness, responding to your baby's needs and feeding cues. You can't overfeed a breastfed baby. Breastfeed your baby when your breasts feel full. So if you had a turnover in the night and your breasts feel full, you should wake your baby up. We use it as comfort because babies don't have any rational thoughts. Sometimes babies just want to be near their mum and on their breast, and it really calms them down. You can't overfeed a breastfed baby, so it's always appropriate to offer the breast. You can't spoil a baby by picking your baby up and feeding many times, so it's always appropriate to do that. And I think I've said you can't overfeed a breastfed baby. Babies self-regulate, so they decide how much they're taking, as long as you offer the breast when the baby wants it. And responding to your baby's needs will encourage good brain development for your baby. So how long are feeds? Well, it varies a bit at the start, but essentially feeds range from 5 minutes to 40 minutes. And for the first day, they may feed not many times. Some babies will feed a lot. But after the first 24 hours, really a baby should have a minimum of 8 feeds in 24 hours. And when a baby, after a couple of days, the babies get into a routine with their sucking. So they do quick sucks at the beginning, and then slow and rhythmical in the middle, and you will hear swallows when the big water comes in your milk, and they do little flutter sucks at the end, and they don't always swallow, but what they swallow is more calorific and less volume, so it's a normal part of feeding. And then after your baby does that, if your baby comes off, it's completely appropriate to go to the other breast. If you have a baby that has some risk factors, we will support you with a feeding plan. And we may check your baby's blood sugars, and depending on when your baby's born will depend on which blood sugar we work on. And when we have guidelines that we follow, and when these levels are stable, we will stop doing the blood sugars and you will just be responsively breastfeeding. So position and attachment with your baby, it's really important, and we can give you lots of support on this. Lots of information about position and attachment in the Mothers and Others guide. So positioning is how you have the baby, and attachment is as the baby goes on, and we use a chin analogy, which means close, head free, nose to nipple, and the baby in line and in a position that you can sustain. So we'll quite often see us teaching different things. There's all different positions you can do, but the trick is head and body in a straight line, facing you, held close, nose to nipple with freedom to move the head. And if you look here, I've got the baby nice and close, but the baby's got a free head. If you do that, the baby can't breathe, so we don't want you to do that. So like that, and sometimes we'll teach the exaggerated latch where we'll get you to stick the nipple upwards. And if I move around a bit, you can see nose to nipple there. So you wait for a wide open mouth for the baby, and it's a quick movement leading with the chin, and the chin touches well away from the base of the nipple. So there, upwards and backwards to the roof of the mouth. And then we will get you to move your positions and hold your baby in there. We don't want you holding your breast up there. It's angle of the dangle where your breast stops, where your breast rests. So how do you know if the baby's on properly? Well, you'll see the chin will be indented into the breast. You'll see big fat cheeks full of breast tissue, like that. If your areola is big enough, you'll see more areola in the baby's mouth at the bottom, and some will be free at the top or the side. How does it feel? Well, it can be a little bit uncomfortable for the first couple of days, but it shouldn't hurt. We're not designed for it to hurt us. So if it's still hurting as the feed goes on, we will teach you to put your little finger in the baby's mouth, up to the top of the mouth, and try again. It's really important that you don't take pain, because you can end up with marks on your nipple, like lipstick marks, or they can break down, and every suck swallow it'll hurt. So it's really important that the baby's on effectively. You can have as much feeding as you like. You can feed twins, triplets. If your baby is on effectively, it shouldn't hurt. So that's this is actually the most difficult position to do. When we're established, most of us feed like this. I would say it takes us about 6 weeks to feel really confident, particularly with our first baby. If you've had a cesarean or you've got larger breasts, you might find it easier to do this position, but the principles are the same. Head and body are in a straight line facing you, held close, nose to nipple. What you have to be careful is pillows. I mean, you can use a pillow for under the arm, but the other positions I'd be reluctant to do. If you've not had a cesarean, we quite often teach this laid back position. It's so lovely. And the baby will do some head bobbing, which are feeding cues, throw themselves off, and they'll be on a 45-degree angle. And women really, really like this position. We can also teach you to feed laid down. We find women really find that useful. We will talk to you about safer bed sharing when you have your baby. And really, it's just a wonderful close time. It's really important that you understand what cluster feeds are. So cluster feeds are when your baby feeds quite a lot, sometimes for 4 hours. Parents tell us it's quite often in the evening, late afternoon, and we think it might be a growth spurt, but you put them down, they want to feed, you put them down, and this is where mums quite often question whether they've got enough milk or not. But the baby's just putting in the order for more milk. So the more breastfeeding you do, the more milk you make. So if you were to give formula, which you wouldn't need to do, it can affect your milk supply. So you should only have to supplement if there's a clinical reason. And remember, I know I keep saying it, but you can't overfeed a breastfed baby. Parents really, really worry how to tell if their baby's getting enough milk. So at least 8 feeds in 24 hours. Remember those 5 to 40 minutes for feed off of both breasts. You can use some breast compressions, try and get more milk in the baby. But a really, really important thing to know on nappies. So in the first 4 to 6 weeks, what's in the baby's nappy is really important. At the start, the first 24 hours, the baby needs to wee and poo with that black poo meconium. And then after day 1, we want a minimum of 2 poos, at least the size of a £2 coin. You can have bigger if you want. And that poo will start to change colour. So it'll start off dark black, and it'll go brown, then it'll go green by about day 3, day 4. Day 4, day 5, we want yellow poo. So a minimum of 2 yellow poos, watery, yellow with bits in. The more the better. And it's the same for the wee. The urine starts off small amounts because colostrum is on purpose small amounts, and then they'll get heavier. So day 3 you want at least 3 wet nappies, day 4 wet nappies, day 5 wet nappies, day 6 heavy wet nappies. And a heavy nappy is like 2 to 4 tablespoons of water in a nappy, so that's how you tell. It's a really good indicator. So the colour of a change in poo is really important. We will weigh your baby usually on day 5, and we'll do the blood spot and do the weight. So babies are designed to lose weight at the beginning. Normal weight loss is 7 to 8% of their birth weight. So I've also written a guideline that allows us to manage breastfeeding, mostly at home, up to 12.6% loss. I mean, we don't really want that, but we can manage it. The only time that we may see your baby go into hospital is if your baby's jaundice and requires treatment for jaundice. But the best treatment for jaundice is frequent feeding. Really important. On discharge from hospital, you will be given some paperwork at the moment, and for breastfeeding mums, it is this sheet of paper. There is a QR code there that gives you access to our Padlet at Prince Alexandra Hospital, which has got lots of feeding resources on it, and there's lots of places you can contact your midwife and other breastfeeding resources. But we also give you this, which is a parent's guide of how to tell the baby's getting enough breast milk. So it's everything I've just talked about, and this is UNICEF, so it's very good. And this on this side, it tells you when everything is going as you want it to do, and the stuff in the right is when you may need help. It's a great resource. I would urge you to use it. We will also give you the Department of Health's leaflet, Off to the Best Start with Infant Feeding, and that's also got, it shows you a change in stool colour, and it shows you effective position and attachment. It's a wonderful resource, along with the Mothers and Others guide.